I can tell you in medical school, they were actually still teaching that for autism, the only FDA approved treatment is risperidone. They're still today teaching that in medical school, and they're not looking down any of these other, not looking into leucovorin or any of these other avenues that we are through biomedical treatments. Yeah, so I've actually seen quite a few kids on the spectrum that probably would not qualify for the diagnosis anymore if they were retested after going through all of our treatments. And what we do with the biomedical treatments for autism even complements their therapy. So, their speech therapy, their ABA therapy. So, I always tell parents when you do both of these in combination versus one individually, your child's going to advance even more. And you're going to see far more. Like, I've had children that were getting ABA and speech therapy, and then they started doing these treatments. And they saw such advances without telling the therapist. The therapist would be like, they're comprehending more, they're understanding, and they're participating more in the therapies. Teachers, I would say, I don't know what you're doing with your kid, but they're understanding the content more and they're doing better in class or they're sitting still more. Yes, there are actually 2 treatments specifically that I do that a lot of times I get. I'd say 99% of the time, I get reports of they're saying more words if they were speaking before, or they started speaking if they weren't.